The impacts of drug use during pregnancy. We're going to take an in-depth look at the impacts that drug use has on pregnancy and the fetus before and after delivery. Are you pregnant, or do you yourself use drugs? Let's take this opportunity to educate yourself on what goes on within your body and the effects it has on your baby. Education has been proven to be the key to treatment. You can't help what you don't know. If you or someone you know is struggling with addiction and is pregnant, please take into consideration the effects the drugs will have on your baby. There are many treatment centers available to help. Please reach out to your local services to receive that help. When using drugs, they cross through the placenta by way of the mom's blood, and they pass into the baby's bloodstream. This causes the fetus to become dependent on the drug as well. You can see in this picture the placenta and how the umbilical cord is connected to the placenta and to the baby. That is the passageway that the drugs will take to get to your baby's bloodstream. After birth, the baby will also suffer from withdrawal symptoms. It's not just you anymore. You have to also think about this precious baby. If you use drugs when you're pregnant, it leads to what's called neonatal abstinence syndrome. Some people refer to it as NAS. This is when a baby is born drug dependent. Most commonly used drugs during pregnancy are cocaine, heroin, opioids, benzodiazepines, marijuana, tobacco, and alcohol. But the ones that are that cause NAS most are the first couple: cocaine, heroin, opioids, and benzodiazepines. So let's just take a look and let's compare. Oh, that precious baby. This is a baby born at full term with no drugs in his system, healthy, and he's able to go to the well baby nursery and go home with mom. This, on the other hand, is unfortunately a baby born prematurely, unable to breathe on its own outside of its mom's womb. Neonatal abstinence syndrome is when the babies are born drug dependent, and they've been proven through research to have a low birth weight, being born prematurely, have respiratory problems, withdrawal symptoms, and many other issues that can cause the baby to need hospitalization after birth. These babies have really high-pitched cries. They have problems sleeping. They have hyperactive reflexes. They're very tense. They cannot get comfortable. They will cry, and if you touch them, it hurts them. They don't like to be touched or held. They're just never comfortable. It's very sad to see if you've ever seen it before. They have tremors, their body's shaking, much as like if you were an adult withdrawing from drugs, the baby goes through this once it's born. Like I said, muscle tightness and even seizures. It's actually very scary. Would you want to view your baby through these holes? Babies born prematurely cannot regulate their own body temperatures, and they need to be in isolate. This is an isolate, and when babies are born and they cannot regulate their own temperature, they have to be placed in this to keep them warm. Oftentimes the mom's not able to hold the baby, and you have to touch your baby through these holes so that the baby does not get cold, which can lead to many other problems. Once born, babies are treated with drugs to combat their withdrawal symptoms. Some of the drugs that they're treated with most commonly are methadone and morphine. And as you know, these are two very strong painkillers. So if you can imagine what they do for an adult, just imagine, a baby being on these drugs. It's not what you want your baby to have to go through as a newborn, but this is what they have to give these babies in order to slowly wean them off of the drug dependency that was created in mom's womb. It's really not worth the risk. Reach out and get some help for you and your precious baby.